the stage. Mm-hmm.
Oh, there we go. That's better. Okay.
Now I think you're buzzing.
Okay.
I think that's right.
Okay.
Okay.
Sorry. 2 minutes of watching us trying to figure this out. Okay, so today is a hyaluronic acid filler. So, thank you. What are hyaluronic acid fillers? So, it's synthetic, but they are made out of hyaluronic acid, which is a natural occurring substance in your body anyway. So, benefits of hyaluronic acid fillers: they are made to create volume in areas that you need it. So whether that's cheeks or chin, or you don't know, you just want me to look and see, it will create more of a structure where it stays lifted, and hopefully you get a good 1 to 2 years out of it, just depending. So I'm going to kind of talk more about it, get in a little bit more detail. And I'm going to also show you what this substance is, and also how much of it there is. So hyaluronic acid, I have a lot of questions that I get. I think there's a stigma on fillers, where I'm going to turn this light down because it's really distracting. Good grief. Okay. So typically people are like, oh, did you see that girl? Like, she had a ton of Botox in her face. Typically who are, oh, hold on. Oh my gosh, this is so bad. YouTube. Sorry, guys. Pause that. Turn that down. Okay. All right. Back. We're good. We should be good now. Good grief. So, yeah, typically people are like, oh my goodness, like, she's got a ton of Botox in her face. It's not Botox that you're seeing. Typically, you get Botox, nobody even knows you get Botox. So hyaluronic acid fillers, they can be overdone and overused. So me as an injector, I would never do that to anybody. My goal here is facial balancing and not overfilling because somebody wants bigger and bigger and bigger lips or bigger cheeks or wherever it is. So there is such thing as overfilling, but there's also such thing as natural, completely natural looking results. And that's why I'm here. So, where can you get filler? There are a lot of places in the body you can, including your earlobes if you have kind of weird no volume in your earlobes. Some people do that. So you can do that. Common areas to get filler is in your cheeks, whether that's your medial cheek or outer. Benefits of doing your medial cheek, obviously it fills in that volume that you lose. And it also helps with when people say you kind of look tired. It will kind of transition with your tear trough junction, and it just softens that overall look. If you're not sure, obviously come see me because that's what I do all day long, and it says people's faces, tell you what you need. So if you don't know, set up an appointment with me and I will help. Benefits for outer cheek. Obviously, you get a little bit of that volume if you need it, or just for aesthetics wise, you can use it for that. But it also kind of helps lift. So everybody has their nasal labials right here that most people hate. But if you put that filler in there, it can actually lift up the tissue and kind of soften those nasal labials with giving you a little bit of a structure on your face too. More common areas is obviously your lips. I'm actually going to be doing a little demonstration of lip filler later. My guess is I'm probably going to run over the 30 minutes. So if you have that time after the 30, you can absolutely wash. I got my model here, Sarah, today. So I got her all nice and numb, so she's ready to go. Lips are very common. So again, you see the gals that have the big old lips. That's not what we're going for. Filler in your lips is when you get a little bit older, you tend to lose the skin on your lips. It thins out. Your lips get thinner, as well as under the eyes, but I'll get there at one point. So that's one of the first to go because it is a thinner skin. So typically people come to me and be like, "Hi, my lips are all wrinkly and there's no volume and they're smaller. And I used to smile and I would have an upper lip when I smiled." That's where this would come in. Filler would come in for that. Excuse me. Common area as well, chin. A lot of times people don't know they need chin filler, and I've had a lot of that. I'm like, hey, let's try it. Let's benefit from this. I assess thirds of your face, and that is where I kind of assess the facial balancing piece to it. So a lot of people, who don't know, I mean, you don't look at your side profile every single day, so you don't know the protrusion. You don't know about the hollowing maybe that you have right here. Again, that's where I come in. So others, when you get a little bit older as well, temples. That's a common area to get filler. People tend to hollow right here. You have a natural hollowing there, which is fine. And we just put a little bit of filler in there and it just softens. How it softens obviously gives it a lift, but it also pulls moisture to the surface. So it's hyaluronic acid based product. So it's going to draw moisture to the surface. So you're getting a smoother look in about 2 weeks after you get injections. It's going to smooth out and you're not going to feel lumps and bumps and all the things that you would typically feel when you leave here. You don't see these lumps and bumps, but you can feel them. That's another perk for getting a little bit of filler in your lips. If you have chronically chapped lips, it's great for drawing moisture and keeping your lips more smooth and moisturized. So less chapstick for you. It's fantastic. Other areas we tend to do, we can do more superficial injections like nasolabials, marionette lines. Typically when you kind of lose that little bit of volume right in here. Here as well, is filler the best option? Yes and no. Filler is an instant gratification. So we put filler in there, you're going to see it immediately and it's going to stay. Is it fixing the core problem, which is probably collagen loss, fat pad loss? No, it is not doing that. So typically, I will talk about this in another webinar. Biostimulators, I'm a big fan of those when it comes to those areas, but you can do hyaluronic acid fillers in those. So watch me for that video. It's coming up. Can I use my extra lip filler in my cheeks? Recommended, no. Not that it's going to hurt anything, but different areas on your face require different kinds of filler. So why that is, so for example, for Sarah today, I'm going to be using Rest and Kiss, which is a very soft, flexible, very natural looking filler. So if I were to do that in your cheeks, typically you don't see as good of a result. So you put it on the bone, in between the muscle, which is typically where our injection site is, just to kind of give you that lift and stay. And that Rest and Kiss isn't going to do that for you. We're going to go more towards a stiffer, more dense gel filler for that. So I don't like to use it, but if you're like insist, like I want to use the rest of my filler in my face, this and that, just know that it's not going to be probably what you're desiring. So yes, as long as you guys know that part, that's why. Am I going to look fake? No, absolutely not. You're not going to look fake. I promise. You're going to walk out of here and you're like, oh my gosh, I didn't know I needed that. I look refreshed. I look awake. I look like I just came off the beach and all relaxed. It is very, very natural looking. Yes, if you get an injector that's like okay and willing to give you more and more and more, and that's years of buildup. That's years of people going in and being like, I need my 6-month filler, and then they end up looking like a, did I say bimbo? Something along those lines. Use your terms. Common side effects of filler. So there's not a lot. Very rarely, there's always a risk. Anything foreign that you put in your body, you could potentially have a reaction to. The good thing with these HA fillers is we can always reverse it. We can always dissolve it. So if you're like, I don't like this at all, and which has never happened to me, and it's not gonna happen to you. But if it does, you can be like, I don't want this anymore. We can dissolve it. We can get rid of it. It's not a permanent thing. Your body always metabolizes it anyway. It may take a year or two, but your body's going to metabolize that filler, and it is never permanent. So also keep that in mind. Usually common side effects is bruising, mild swelling, especially in the lips. That's kind of a small, tender area. So we typically do some sort of numbing for you so you're completely comfortable during the whole procedure. Mild swelling, bruising is kind of the most common side effect, or I guess outcome after the injections. And then just a little bit of soreness too, just depending on what area that we are treating you. So those are the most common. Is it going to migrate? No. Yeah, no. If you follow your aftercare, which I'll go over, you're going to be just fine. Nothing's going to migrate. We're not going to overfill you. We're going to use the correct filler in the appropriate areas, and it is not going to migrate. So over time, if you get overfilled, absolutely. Think of your lips. So you have your lips as a capsule, right? So if you do it for years and get tons of lip filler and over and over and over again, it's going to start kind of coming out into your upper lip and even around your mouth. And it's going to kind of create that like Marge Simpson lip where it kind of, you almost look ducky. The ducky technique also can be the injector and how they injected the lip filler, but we are highly trained on that. We're not going to do it. Does it hurt? So I have people fall asleep in my chair, and that is not a lie. We offer dental blocks for lips, even some of your chin, because the numbing will kind of go down a little bit, so it's going to make your chin pretty darn comfortable if we do some sort of dental block. In the cheeks, I typically do topical numbing, like a cold spray, something just to make you as comfortable as possible. I don't have a whole lot of people complaining of a lot of pain with fillers. Typically the soreness afterwards, yes, you may be a little sore. You'll want to take some Tylenol just to kind of help with that soreness. What else? Pre-care. So again, big side effects of filler after injections is bruising. So we kind of want you to avoid NSAIDs like ibuprofen, aspirin. Green tea is one of them that I learned. Anything that's blood thinning, you'll really want to avoid that about 72 hours prior to your injections. Bruising, it happens. It's just going to help you not bruise as bad. So that's kind of the big one. You want to hydrate tea before. What else? I'm drawing a blank. It's mainly the aftercare here. So post-care, again, hydrate. You have hyaluronic acid in your face. Hydration is going to be key to keep that nice and plump, and you heal a little bit faster with that. You can take also prior to your treatment, you can always take an arnica. You can get that in a gel form, or you can get that orally too, and that will actually help you from bruising. You can take that pre-treatment and post-treatment. I typically put on arnica topically after lip filler injections, just so you kind of have that on there right after. We pull. Oh, sorry. No, I just so post-care, you're not going to want to drink out of a straw if you get lip filler. You never want to rub, massage, manipulate the area where it's treated, because you can move that product, and that product is not settled into your tissue quite yet. After a couple weeks to a month, I mean, you probably still don't want to push too much on it, but it's going to be more settled in that area versus right after injections. you have more of a risk for it to kind of go where we don't want it to. Not that it's going to occlude a vessel or anything like that, but it might look, your results are going to be a little bit different. What else for post-care? I wouldn't raise your body temperature for a good 24 to 48 hours. So that kind of excludes working out, getting hot tubs, hot saunas, those kinds of things, because it can affect blood flow and it can affect the results, the efficacy, and everything of the fillers. So that's the same with, honestly, a lot of our procedures that we do here, including Botox and laser treatments and all that. So if you work out, keep that in mind. You'll definitely want to do your workout before you come in, not right before, but maybe a day before you come in to get your injections. What else? I feel like I'm just yep. So what to expect after fill injections. This isn't so much post-care. It's more right after, when you get up and you go to touch your face or you look in the mirror and you're still sitting in that seat. Bruising, sometimes you could see it right away, sometimes you don't. That's typically a day or two after. You'll be like, oh, I got a little bruise over here. Totally common. If you do touch the area, of course, be very, very gentle, but you're going to feel lumps. You're going to feel lumps. You're not going to see them, but it's going to feel lumpy. That product has not integrated the tissue, and it has not softened out. So give it a good 2 to 3 weeks for it to do so, and you shouldn't feel anything at all. A little bit of soreness, if you do a dental block and you go home and your numbing wears off, you're going to have a little bit of soreness afterwards, but again, take some Tylenol. Take it easy. It's just like doctor's orders. I'm just going to relax and drink a lot of water. Not out of a straw, by the way. So that's pretty much what to expect. We assess your face. We are very, very highly trained in, as far as safety, what to do for safety checks and all of that. So your procedure it's quite safe. We do use different kinds of techniques. We use needle technique. We use cannula, which is just a little bendy catheter, kind of like when you get an IV, and the little catheter is just in your arm, but you take the needle out. It's just a little bendy plastic thing. So just depending on what area that we're treating and what the best technique would be for you, and what layer as well. So I'm going to turn over to Sarah, our beautiful model, since we have 10 minutes left. And I don't know. Get that. I'll talk louder because I know that you guys couldn't hear me last time. Right? I'll get closer here in just a second. I guess I gotta get the filler. I'll get that. It's fine. Can you grab those little beads? Thank you so much. So Sarah, she's had a little bit of lip filler in the past. So keep in mind too, if you come in and you have teeny tiny lips and you barely have any tissue to work with, you're probably not going to get a big rush lip that you were looking for. It's just not going to happen. I mean, it could be a slow process and we can kind of slowly expand your tissue, but we can't make that really much bigger. So keep that in mind. I have gals that come in and they're like, I want the Russian, like, baby doll. I'll do what I can, but it doesn't always come out that way. So Sarah, she wants a natural, very natural lip, which always, but she came in, she had teeny tiny lips the first time she ever came to me. So we have been able to, I just won't do that now. Mm-hmm. Just over there.
Yeah, these two.
Yeah, that's fine. I'll just start at the middle and then we'll let you later.
Okay.
On the outside. So typically, let's see. So we gave her a little bit of volume, and the first time I ever gave her filler was probably about 1.5 years ago, 2 years. It's been a while. So we've had time to kind of expand her tissue and make it where we can put a little bit more product in. I'm probably not going to use the entire syringe on her lips, even though she has came to me before, because she has small lips. If you have like mine, which are small, but they call it the Cadillac lips. So I have a lot of skin and a lot of extra space in my lips that you can put a lot more filler than you can in somebody else. So always keep that in mind. Wrestling Kiss is my absolute favorite for the lip area. If you had the right lips to do a little bit more of the baby doll Russian, we can probably use a little bit more stiff filler to kind of create that look that you're going for, but you have to be a really good candidate for that. If you come in and you know, say you're 60 years old and you're like, I want bigger lips, you're not going to get a stiff filler because your lips are thin and you're going to get something that's more soft and not going to look so abrasive on your face. But with Sarah, we are good. She's got great tissue. Great shape. She's numb right now, so she might look a little wonky. And I'm just pre-filling it into little beady syringes. I have small hands and I cannot handle this big syringe. I just can't do it. So I'm just going to kind of show you a little bit. We have 6 minutes-ish left. Kind of how it happens and how you can instantly see the volume. Keep note, she is going to be swollen. So don't be like, holy crap, that's wild. Her lips are huge. They're going to go down by 1/3 in about 2 weeks. So the swelling, yes, it's going to go down 1/3. 9 times out of 10, people come back and they're like, I want more filler. I need more filler. I thought this was too much, but it's not. Happens all the time. So I'm actually, I think I'll go this time first. This will be proof that this is completely painless with the dental block. If you're like, I don't want a dental block, I hate the feeling of being completely numb. We do have other comfort menu options that you could do. Even if you want to do Pronox, which is laughing gas, have that. But usually dental block does just great. That's usually the preference. So let me know if you feel anything sharp and pokey, okay? No? Nothing? She's just chilling. She knows. Mm-hmm. So when I look at Sarah's lips, I'll just have you open just a smidgen for me. I see a little bit of volume loss right in here. Shape is great, but we just want to add just a little bit. And like I said, I'm not doing the entire syringe. So kind of breaking it down on how much is in an actual syringe. If I were to put that entire 1 cc of product onto a hard surface, it is the size of a blueberry. So it's not that much product. You might look at the syringe and be like, that's a lot. It's really, really not. It just, the syringe is deceiving, I think. So if you want to watch this, some people can, some people can't. If Sarah was not numb, she would be coming out of her chair. What we are, and we just do a little bit of volume. And everybody's different. Everybody's different on what they want. What I see is an injector where they have that volume loss. What time we got? it to go a little. You said you're not numb out here, right?
Mm-hmm.
I'm gonna go down in my chair. I don't know if we can be able to see her. Just because I'm gonna inject. It's going. Yeah. Perfect. So. I always want to make sure. I just want to be able to show you guys just a little tidbit of instant volume. I'm obviously going to be working on her a little bit longer. Okay. So, sir, if you want to kind of look at the camera, I don't know if I can get a little closer. You can see Insta volume on that side. Beautiful. Typically, the bulk of the swelling hits in about 7 minutes, but you can kind of just get an idea of. We're not putting a lot in. I literally put less than 0.1 of that 1 cc syringe, like a quarter of it. And I think her volume is great. We're going to move on. Do we have any questions so far? No? Okay. I have too many tabs up. I'm just not going to do that. So typically, she has a great shape, but you just like to enhance it just a little bit. Okay. So before I get too much further, I'm going to keep working on her, but my next slide here. Not sure where, what, oh, there it is. Okay. So, call to action. People that have joined this webinar today, if you book your filler appointment in the next 24 hours, you get 15% off of all syringes used at your service. So whether that's you want to eat your cheeks and your lips and whatever, you get 15% off. Just know if you come in here and you get 3 syringes in your face, you're still going to walk out of here looking 100% natural. Sounds like a lot. It's not. It's injector technique. It's where we place it. You can look amazing. So mark that, guys. Book the next 24 hours and get 15% off all syringes. VIP members, they get the same. Plus, they get 10 free units of tox. So there was one thing, the membership, like because they get the percentage off, and it exceeds it. So hold on, guys, I'm gonna have to look at some things. I'm challenged. Right. Yeah. No, where'd it go? I had all my stuff in there.
I didn't exit anything, I promise.
I know. That's weird. Just know your VIP members, you get 10 units of free tox, and it might be something extra. Just know that. So, thank you for listening to me ramble and not stumble over my words. Yeah, I appreciate you guys joining. I'll see you next time in July. I'm going to be doing another webinar, so stay tuned for that. I'll post it on Instagram about time for it to happen. So be on the lookout, and we'll see you guys next time. If you have any questions, please come forward. Stop it.